The Government Accountability Office just released a shocking interim report on widespread fraud within Obamacare. Let me explain what's going on. During the pandemic, the previous administration took a variety of actions that weakened crucial safeguards. For example, they eliminated common sense income verifications, which are central to making sure people actually qualify for the program. They also expanded the number of people who got completely free health insurance via what are called $0 premium plans, which is a huge problem because if you don't pay anything for a plan, you might forget that you have it, or you may be enrolled in it by an unscrupulous insurance broker without your knowledge. To date, we've received complaints from hundreds of thousands of Americans who didn't know they were enrolled in an Obamacare plan until they got paperwork from the IRS related to their tax credits. So, why was this allowed to happen? Because the past administration prioritized achieving big program enrollment numbers over protecting program integrity. The problem here is that you, the American taxpayer, are footing the bill for all of this fraud in the form of tax subsidies. Under President Trump and Secretary Kennedy, we are not sitting idly by. We've uncovered 4.4 million improper enrollments, including roughly 1.6 million individuals who were enrolled in both Medicaid and an Obamacare plan in 2024, which taxpayers, by the way, are footing the bill in both of these cases. You get double insurance. You're not paying for either. We've already started cleaning up the system by removing about 1 million people from Obamacare who are or should be covered somewhere else. This alone is going to save taxpayers billions in waste. In fact, the very first rule we announced in this administration was our marketplace integrity and affordability rule, which would have, and I'm listing it out, enforced common sense income verification checks, made sure people who were enrolled knew they were enrolled, and blocked illegal immigrants from accessing taxpayer-funded care. But here's the bonus of it all. Our rule would have lowered premiums across the board for Americans by an average of 5%. That's a lot of money. Now, we're on track, doing fine, until blue cities brought a politically motivated lawsuit against us, tying up this important rule in litigation. I want to applaud Congress for at least giving us some additional tools through the Working Families Tax Cut legislation that will enable us to bolster verification in future years. Meanwhile, we're continuing to fight every day to clean up the Obamacare problems, and as this report rightly points out, there's still a lot of work to be done.